Assalamu alaikum, all our viewers all over the world. It's my pleasure tonight to start our first episode of our program today, Health is Wealth. And our topic will be about the risk factors of cancer. Really, the topic today is, it took a long time for me to prepare for this, as the risks is all around our daily life, daily routine, while we're sleeping, while we're going job, while we're coming back home. We are living in an era where carcinogens are everywhere around us in our daily life. Let me start with the definition of cancer to know what is the meaning of cancer. It is simply uncontrolled abnormal cell growth, or in other words we can say immortal cells which have the ability to invade and grow in other parts of the body. And here comes the difference between benign and malignant. As a malignant tumor, it will spread and invade. As a benign tumor, it will remain in its place. Just to know, there are more than 100 types of cancer out there. I mean, cancer is a very broad word, but if you're going to divide it, it can be a cancer, it can be a sarcoma, it can be a germ cell tumor, it can be a lymphoma, leukemias. So more than 100 types out there, and each and every type has a specific behavior, different reaction to treatment. And here comes the issue of, is it curative or not curative? Well, the answer is not all cancers are curative. Some are curative, some are not. But the good news is, in the 21st century, people are having a better lifestyle and quality of life in regard their response to recent treatment. Just we need to go through some numbers again, which is important to understand that cancer is killing more than 10 million people annually worldwide. Lung cancer being the most common in men, and breast cancer being the most common in women. What we need to know is the global burden of cancer is increasing annually with more than 18 million new cases annually. And really, this is a heroic number. Before starting through this, I just want to show you that, or confirm that cancer is something very, very old. Up to, they have discovered cancers in dinosaurs. And here we have some diagrams showing the dinosaurs' bones, where we can see bone mets in the fossils. Dinosaurs lived more than 200 million years on Earth. We have another photograph, another figure. Next. Here also we are showing how these bones are being discovered, bone mets are being discovered in the dinosaurs. Cancer was traced before in the old Egyptian mummies, in human beings I mean, which is around 3,000 years ago. So it's not something new, but really the pandemic we are living here in this era is the number of cases. It's increasing with 18 million new cases annually, and going to reach 27 million new case in 2040. Next. Here are some photographs. I am trying to show what cancer looks like under electron microscope. It's really scary. It looks like a crab. Next. That's another cancer you can see. Next. Here's another photograph. This is the real cancer cells, real footage. Next. Here is just a graph showing the growing number of cancer. Really, it's doubling from 2000 to 2018 to 2040. And the cost is coming in trillions. The burden of cancer costs worldwide is coming in trillions of dollars. Next. Here is the WHO. It's telling us the cancer economic cost is more than $1 trillion worldwide, and in a paper I have read, it's going to cost more than $20 trillion in the next 30 years. The point here is we need to understand, why is cancer increasing? Why is cancer having this wave on human beings? This is what I'm trying today to explain. Here we have another photograph which is showing the difference of cancer distribution from country to country, being the highest and the lowest. Yes, Denmark and some European country having the highest rate of cancer, and most of the African nations having the lowest, and that we will come and talk about that. So the numbers are really scaring us with all these new cases annually, with all the different types of cancers, in the different system, with the different behavior. Yes, the good news is the overall survival of cancer patients have increased more than 40% in the last 30 years. But still, we are having a big problem. So here, to just understand the risk factors, what I'm trying to talk about today is the most common risk factors that is really affecting our life. The first thing I'm going to talk about is air pollution. Air pollution, just to clarify the danger point of air pollution, that it's killing more than 7 million people annually, whether for cancer or for other lung diseases. And here, air pollution we are talking about, it's not only the outdoor air pollution, and also the indoor air pollution. Simply, there is a word VOC, the volatile organic compounds. These are the real criminals out there, especially at our home. Air pollution, yes, as all the people know, the carbon monoxides, the O3, the ozones, the nitrogen dioxide, pesticides, particulates, radon radiation. Just to clarify, what are these chemicals doing to us? These are damaging our DNA. The DNA is the genetic material which is working day and night in our nucleus, inside our cells, to provide different functions for each cell, for each system. All these pollutants will cause oxidative stress and damage the DNA repairing mechanism. And this is how it will start causing a state of chronic inflammation. Chronic inflammation will irritate the DNA. More and more mutations will start. DNA repair will decrease, and all of a sudden, cancer will appear. The immune system is trying to fight cancer every day, but at a certain point, the immune system will not be able to do that. And it depends on the dose, the cumulative dose we are exposed to. I mean, if people living in a highly polluted city, and those who are living in the peripheries or living in other small cities or towns or villages, that will be different. The risk of cancer from air pollution, of course, will be different. People are living outdoor, fresh air, green environment will have lesser risk than those who are living in urban or mega cities like we are living in. Unfortunately, I don't know what to do, but this is the bitter truth. Our cities are heavily polluted with carcinogenic pollutants. In the next episode, I will clarify for you how can we solve all the risk factors, but I will concentrate on this episode just to have a glimpse on the risk factors, to increase the awareness of risk factors of cancer. The second risk factor will be the microplastics. So I have here some figures to show you, just to understand how microplastic is now being a disaster entering the human body. I mean, we can use plastics. My mobile is made of plastic, my glasses is made of plastic, but how did it enter our body? We have a diagram here. You see, this is the microplastic. This is a bottle, we are drinking water. Plastic is a material that will have chemical reactions once it's exposed to different temperatures. And we are drinking this. Our kids are drinking this. We are drinking this. Our families are drinking this. We need to understand that plastic, yes, we cannot live without plastic, but we cannot eat plastic. Or the scientific name is the polypropylene. Is this carcinogenic? Well, yes, it is carcinogenic. It is causing a chronic state of inflammation. It is producing chemicals which is disrupting the endocrine system of the human body. And this is depending on, again, the dose we are exposed to. There's another figure next. I'm showing you. Here is a fish being caught from the sea, and this is what was found inside the fish. Think about it. A microplastic reaching the fish. This is how microplastic is reaching our stomach. Recently, scientists have released a study where they have discovered microplastics in our hearts. Next. That's another figure. Fish. Inside the fish, plastic materials. By the way, these plastic materials, we have thrown it in the sea. So next time, take care of your plastic bottles. It will harm you indirectly. So imagine, I just want to clarify, plastic is like, it's having a estrogen-like chemical which is harming us. Here comes, there are BPA, which is the famous BPA, BPA free. Still, it needs a lot of research. Do we need plastic? Do we need to eat plastic? Do we need to store our food in plastics? What about our forefathers? They used glass, they used stainless steel, they used other materials, mud. We need to consider this point and trace our plastic intake in our gut. Second risk factor I'm going to talk about is smoking. But smoking, really, there is a lot out there, lots of information. I know most of the people know that smoking is harming us and killing us. I just want to clarify that smoking is killing around 8 million people annually, plus 1 million passive smokers, those who are not smoking but living with people who are smoking under the same roof. So, okay, if we are going to talk about smoking, we should not forget talking about vaping, which is the era, a new era now, that if you want to quit smoking, okay, well, you can go for vaping. Is it a lesser risk? Maybe it is a lesser risk, but guess what? The oily material which is used in the vape is carcinogenic, is irritating the lung, is scarring our lungs long term. And also, it's not only about the oily material, it's about the flavors being added, it's about the chemicals which being added for these oily materials to stay on shelf. All these are chemicals with thousands and thousands of names, especially in vaping and cigarette smoking. Thousands of chemicals that we even don't know. Even today, if you're going to talk about smoking as a plant, a tobacco, what about the paper being rolling the tobacco? Is it healthy? What about the quality of tobacco? What about the additives which the industries are adding for mass production? This is really causing, this is really killing people. This is no joke. And I have a figure next. Here a figure for 2 lungs. Of course, the black lung is the smoker. And here we are talking about a 20 years smoking, maybe 10 cigarettes to 20 cigarettes a day. This is the black lung, and you'll find a small spot, which is the beginning of cancer. This diagram is the reality of a young man who started smoking at the age of 20 or 25, and it ended with lung cancer at the age of 40, 45. And of course, before cancer, they are suffering from emphysema and COPD and cardiac diseases. I'm talking about cancer because cancer is, it's the emperor of all illness. It's really a great challenge. So smoking, you need to reconsider smoking again. It's how much you're spending, daily spending on your smoking. How can it harm you? And same goes to vaping. Yes, vaping is less harmful than smoking, but now we came to know it is harmful. It can kill you. The next thing I'm going to talk about is our diet. And here comes the biggest problem in the 21st century is our diet. How we eat, what are we eating, the timing of eating, the psychology of eating, even the philosophy of eating. Simply, we are eating in this era high calorie diet or empty high calorie diet. Empty calories, no nutrition. Empty calories filled with sugar and salt. And here are some diagrams. Next, I want to show, just to understand what are we eating. And by the way, this diagram here, we are showing what we call the ultra processed foods. Foods which have been extracted from natural food and being processed in a way for mass production by adding chemicals to this food for our children to eat daily. And because it is cheap, fast, and tasty, and it's very tempting. Yes, that's true. It's very tempting. We are eating it daily. Ultra processed foods. It's not just processed, it's ultra processed. The amount of natural food in this picture I have shown is less than 50%. Next. Here is another picture. just to clarify, these are our daily products in the grocery stores. What it contains: chemicals, refined sugar, salts, artificial colors, synthetic fats, saturated synthetic fat. They have add a lot of sugar there, remove the fibers from our food, adding colors, adding preservatives, adding fillers, hundreds of chemicals in our food. And this is increasing the risk of cancer in this era. Yes. Maybe the percentage, we are not sure whether it's increasing 10%, 15%, 20%. Okay, we are not sure, but it is increasing the risk of cancer. Our forefathers didn't have these type cancers, aggressive cancers, or even the number of cancers we are having today. They don't used to eat all this. They used to eat simple, natural food. An apple is an apple. But if you are going to process an apple, take half an apple and start producing a processed jam apple, that is not an apple. Here is another picture. Our kids are really, our kids are victims, because we are choosing this for our kids. High calorie, high glycemic index, low fibers. This is causing obesity, child obesity, hormonal disruption, up to the extent of depression, by the way, because these foods are highly addictive and not nutritious at all. Next. Okay, so the second factor we are going to talk about, yes, I just want to talk about canned food, because this also question come, canned food. Again, it depends on the dose. We are not going to eat daily canned food. Maybe we can eat once a week tuna, or maybe every 2 weeks. But it should not be a daily product, because canned food really, it contains preservatives, it contains mercury, it contains many chemicals that we know and what we don't know, which science is every day discovering. Every day science is discovering new and new carcinogens in our daily food. The next risk factor I'm going to talk about is really, it's a topic maybe in our part of the world we may not be talking about, what we call unprotected sex, or we can call the multiple sexual partners, or we call sexual promiscuity. Yes, our part of the world is different a little bit, here in the Middle East, in Egypt. But globally speaking, sexually transmitted disease is costing the world more than, or at least the United States, costing them more than $16 billion annually, just from sexually transmitted disease. Okay, why this came in the topic of cancer? What is the link? Yes, it have a strong link with cancer. Cancer cervix, anal cancer, penile cancer, unfortunately, very, very high risk because of multiple sexual partners, because of sexual promiscuity, because of homosexuality. And here, the word STDs here, we are talking about a group of viruses and organism affecting us or affecting our patients, which are oncogenic viruses. Here there is a figure, anal cancer, which I just want to clarify that the word anal cancer is not rectal cancer. Anal cancer is in the skinny part of our anus, which is one of the most aggressive tumor out there. And really, it is resistant to all types of therapy, whether it's chemotherapy or radiotherapy. It's a disaster. So let's come back to the STDs. The human papilloma virus is an oncogenic virus, which is, by the way, this is the virus which is suppressing the immune system or the tumor suppressor genes, and cancer starts to appear. The other virus, which all of you know, is HIV. HIV, what is HIV? HIV is simply a virus, or we can say it is a virus that causing a chronic state of immunosuppression. Immunosuppression. So why we need our immune system? Because our immune system, the T cells exactly, are the cells which are killing cancer cells in the human body or protecting us from cancer. So this is the truth. I don't know why we are not talking about this. Is the truth. Up to furthermore, and this was during my research when preparing this episode, that the so-called oral sex is causing head and neck cancer, because again it is a way of transmission of all these oncogenic viruses. So the next thing I'm going to talk about, because these sexual issues, it takes a long time, and it's really important for the people to know this issue. The next thing is alcohol. Big topic. The whole world is drinking alcohol. Whether you're going to tell me beer, you're going to tell me vodka, alcohol. Alcohol is carcinogenic. Full stop. Alcohol produces acetaldehyde. Acetaldehyde is carcinogenic. Simple. Full stop. It's a direct carcinogenic. We're not talking about here something which is indirectly causing cancer. No. It's directly causing cancer. And cancer here we mean colon cancer, gastric cancer, prostate cancer, any cancer. Alcohol and cigarette are risk factors. Almost any cancer. Okay. Almost any cancer out there. Alcohol is already killing more than 3 million people directly, and more than millions of people indirectly. The problem, another risk factor we are having, is our sedentary lifestyle. And here I have another diagram. Next, please. Unfortunately, this is our lifestyle. Whether I'm sitting watching television, on my laptop, studying, driving, we are sitting on the couch more than 6 hours a day. And here came another definition, which is sitting syndrome. Okay, what's a sedentary lifestyle? What is the problem to have a sedentary lifestyle? Or what is the link of sedentary lifestyle with cancer? Okay, simply, sedentary lifestyle increase blood pressure, increase sugar. Increasing of sugar will increase insulin. Insulin is an anabolic hormone and causes cell division, and it push for cancer cells to erupt. Dysfunction of the immune system because of the high cortisol level from the sedentary lifestyle we are living. This is a state of chronic inflammation in the human body. Sedentary lifestyle really is something that we need to fight, and we need to strive to change it. In the next episode, I will clarify that. Last but not least, 2 things for those who are going to the gyms. Please, I beg you, don't use anabolic steroids. These are testosterone analog or testosterone-like effect. These are carcinogenic. Simple. Addiction, same thing. Addiction, whether it's heroin, it's cocaine, it's marijuana, these are carcinogenic. Yes, they are carcinogenic because a lot of impure chemicals added to these chemicals that you are ingesting or taking, which is killing you, up to pesticides. Last but not least, what I want to tell our audience today, that there are more and more risk factors out there, by the way. But what I'm trying to say is each and every risk factor will increase the risk of cancer 10% or 20% throughout our life, from the day one we are kids till the age of 50. The cumulative effect of this carcinogen have caused, from every 4 person, 1 will have cancer. And 70% of these cancers are preventable. We can prevent all this by just tracing, tracking, and changing our lifestyle. Stay tuned. Thank you for this episode tonight. See you next time. Allah Hafiz.